Hello again, everyone. I'm Lyndon. Thank you for that friendly introduction and kickoff, Samantha. I am a University of the Pacific alumni, so I wanted to start there. It's always exciting to come back and have this opportunity to talk to current students, alumni, staff members, and really have that space to network, build community, and talk about topics that we know are of interest to this group. Again, I went to University Pacific and graduated in 2009. Got my master's degree while I was there in education administration and student affairs. And I've had a long, illustrious career that has currently landed me in human resources. So right now I work at UC Davis in our leadership recruitment and diversity services office. And so what I do is I oversee our executive level recruitment efforts. So bringing that perspective to this conversation to talk about how recruitment works, to talk about people's career journeys. And then I also do our diversity initiatives for human resources. So I have the opportunity to do a lot of community outreach, to talk to diverse applicants about the process, and to really focus us on the idea of cultivating a diverse workforce. Previous to that work, I actually was in student affairs. So most of my career has been working with students and, like many of you that are on the call, we've gotten to know the folks that are on our panel today, and they all seem like the types of students I would have loved to have the opportunity to mentor when I worked in student affairs. And so certainly passionate about supporting everyone here today and providing a little bit of insight and support and really facilitating a meaningful conversation for the group. So what we wanted to do before we started was a little poll that I think Samantha is going to launch, just so we can get a sense of who is participating in the panel session today. So once that pops up on your screen, if you can let us know if you're a student, an alumni, staff member, friend of Pacific, my mom, if you're out there, you can let me know. We just want to get a sense of who we're talking to today. And we'll definitely try to tailor our responses and our feedback towards our audience. So that was quick. You all are fast to your responses. And so we can share that poll. All right, so it looks like we have a really good mix of Pacific students and alumni, which is fantastic. We have a number of recent graduates who have the opportunity to share a little bit about their experience at UOP. So with that, we will go ahead and get started. We're going to do brief introductions, and we'll just go around the table for our panelists today. So how about we start with Erica?
Okay, hi, my name is Erica Ramos. I graduated from UOP in 2019 with my bachelor's degree in mechanical engineering. Overall, my role right now is a process development engineer and new product introduction at Abbott Laboratories. And yeah.
And maybe you can share one really exciting highlight about your time at University of the Pacific, maybe a student organization you were involved with, a leadership opportunity, or something else.
Okay, so in terms of my background at UOP, I actually started off as a student athlete my first year. I competed in cross country and track. And besides that, my remaining years, I was affiliated with the Filipino organization, Kilusan Filipinos. Not only was I an active member, but I also was part of the head committees for many of the events that they host, such as Filipino Cultural Night. In terms of the company I work at, Abbott Laboratories is a medical device and healthcare company. I specifically work in operations, manufacturing, and our division is focused in heart failure. So I work with things like LVADs and things such as like HeartMate LVAD and the CenterMag pump that we're currently using with COVID patients. And overall, I am a first generation Filipino American. So one of the first in my family to go to college. And then I was born and raised in Stockton. So I felt like I didn't really have that full college experience because I pretty much commuted all the time. But overall, I try to make the best out of it.
Thank you. Appreciate you sharing a little bit of insight about your background. And, certainly for those of you that are members of student organizations, if you are, maybe you can give a little shout out or a little, a little celebratory hat in the corner there if you're a member of one of these organizations or participated in something that one of our panelists did. All right, let's go to Serena next.
Perfect. Thank you so much. So hello, everyone. I'm so excited to be here with you all today and very thankful to have this opportunity. So my name is Serena Welch. I actually graduated from University of Pacific in 2016. I received my BS in business administration with a concentration in HR, and I also got a minor in economics. I currently work at Kaiser Permanente. So we are a healthcare organization we are in 7 regions. I'm currently in the Southern California region at the Woodland Hills Medical Center. And I am an assistant department administrator, but a fancy word to say I manage 3 departments, well, technically 4, but I manage an oncology department. So our patients have cancer and are currently seeking chemo treatment or chemotherapy or their other options. I also manage a nephrology department, so that deals with your kidneys. So for our patients who are having issues with their kidneys. And I also manage a RN advice center. So when you think about texting your specialist within 6 of our different departments at Woodland Hills Medical Center, you first get triaged by our nurses. And so I manage those nurses before your message may get sent to your specialist. So that's my current role, but I also have a labor of love role within Kaiser Permanente. So I am currently the national co-president for our, it's a long word, Kaiser Permanente African American Professional Association. We call ourselves KAPA, but we are a business resource group. We work externally and internally with organizations, with our community health, and we're really focused on health disparities within our care delivery, and as well as our workforce equity and inclusion and diversity. So that's a little bit about me and my, and I'll get further into like my journey, and I'm just really excited to be here with you all today.
Fantastic, thank you. Yeah, and I know we're going to hear more about the Employee Resource Group and some of those different leadership opportunities. As a member of the African American Faculty and Staff Association at UC Davis, I have a connection to that type of work and certainly understand the importance of that and, you know, your own identity development and leadership. So excited to hear more about that topic. And then last but certainly not least, we have Stefan.
Hi, everyone. Hello, fellow Tigers and friends. So glad to have all of you on today. I am the SEC reporting manager at ChemoCentrix. It is a biopharmaceutical company focused on the development and commercialization of new medicines targeted at inflammatory disorders, autoimmune diseases, and cancer. So I focus on preparing and filing reports with the SEC. I graduated from Pacific in 2012 with dual degrees, a BS in Business Administration, concentrations in International Business and Accounting, and a BA in Asian Language and Studies, majoring in Chinese and Japanese. So during my junior year, I participated in Pacific's Education Abroad program, and I spent my fall semester in Reitoku University in Chiba, right outside of Tokyo, Japan, and my spring semester at National Chengchi University in Taipei, Taiwan. And what really drew me to Pacific was when I went there for one of the days to visit, I fell in love with the campus itself, but also just all the opportunities that Pacific had to offer me. So I was able to do all of the things that I wanted to do, and I just loved my time there.
Okay, I appreciate you sharing that. I'm curious if you could just talk a little bit about, you know, your time at Abbott when you were there, sort of in that internship capacity. You know, was there something about that experience that made you think this is the place, or do you think it was just serendipity that brought you into that role? I'm curious if you could talk a little bit about that.
Yeah, sure. Overall, I really loved the team I was working with. I had somebody on that team who really took the time to sit with me and listen and help guide me. I think overall, having a group of people who especially know that you don't really know all that much, take that time and effort to guide you and give you that input. And I was able to see the facilities, got the opportunity to write up documents. I mean, that job particularly, I wrote a lot of documents, but that particular person allowed me to work on projects that I can't go too much detail, so it's a little difficult. But a lot more, see, it's a little difficult to bring up, but overall, I can't really say too much, but this, sorry, I can't really think at the top of my head, Lyndon.
Yeah, no
But
problem. I think, what I really was getting at too is the importance of, reaching out and taking that leap of faith and doing that, that small internship or that job shadowing or having that small opportunity to really get some hands-on experience in a particular organization. And it sounds like a lot of what you experienced was the team dynamic and the culture of the organization and the things that you really needed to know about whether or not you were going to feel satisfied in that role. And so certainly I think that's a great takeaway for our participants is, making the ask and kind of taking that leap of faith.
actually, would you mind if I bring up one thing that I think really highlighted why I wanted to get into this and stay at Abbott?
Yeah, absolutely.
So we had an opportunity for a patient that showed up. Every year they bring a patient who has an LVAD, one or two patients, and they come in and talk to us. And this man, his name was Earl, and he sat there, told us about all the things we could fix about this product. But besides that, he also told us how much it's impacted his life and how much it's improved his way of living and allowed him to have a second chance. He was on this LVAD for 7 years until he got a new heart. And I think overall that experience made me believe, medical devices do make a difference in these people's lives. And I want to be a part of that.
Absolutely. Thank you for sharing that story as well. I think another very touching story and an example of, that personal desire people have that drives them to healthcare and seeing the role that you can play in supporting others. All right. And how about Stefan? Do you want to go ahead?
So my background is not based in healthcare at all. I did business, and I thought it would be really good pairing with my affinity for languages. So I wanted to do both Chinese and Japanese, and I wanted to do accounting, and I thought international business would go well with that. And so during my Pacific years, that's what I had a passion for, and that's what I really wanted to pursue. And it also took me abroad where I could further develop my skills and kind of connect the culture and the business together. And during my Pacific years, I was really involved with a lot of different organizations like Residence Hall Association and DSP and student advising, and I was a representative for the modern language department and tutoring. And so having all those opportunities, I was really able to, pursue everything that I had a passion for, that I really loved. And when I got to the point of, senior year, I was thinking, how can I, take everything that I've learned and gained from my Pacific experience and apply it to, my next step in life, into going out into the world and the society. And at the time, I thought I would go into public accounting. I started at Armanino, a public accounting firm, in the audit department. And several years later after that, I transitioned into consulting. I worked for many different clients. They were very different companies in various industries all over. And it was all invaluable experience and exposure to how all these different companies operated in these various industries. I was doing a lot of traveling, and I wanted to get to the point where I can really belong with a company and see it grow and grow along with it. And so at that point, I was really looking for the next opportunity from there. And what really drew me to ChemoCentrics was the opportunity to be a part of an organization that focuses on making scientific breakthroughs to transform lives of patients suffering from debilitating diseases. And I find that people at ChemoCentrics are really passionate about science, and it's really exciting about how they're so passionate about creating these medicines in order to help these patients. And I thought it would be a great way for me to apply all of my skills and join this organization that's focused on that.
Awesome, thank you. I appreciate you all sharing some insight into your personal journeys and really talking about maybe some of the ideas you had as a college student about where you wanted to go and where your interests were, and then really digging deep to tell us a little bit about those intrinsic things that motivated you to make that move into healthcare. So I want to talk a little bit more about your experiences in college specifically. So my next question is for Serena and Erica. And so I want you to put on your undergrad hats, think about walking around the UOP campus and what you're experiencing, maybe as a sophomore and a junior. And can you tell us maybe a story or provide an example of, again, either one leadership opportunity, maybe it was a faculty member, a staff member, somebody who really played a critical role in your career path and helping you translate what you were going through and what you were experiencing as an undergrad towards the career journey that you want to take. And then the follow-up question that I have for both of you is, in looking back and reflecting on your time as an undergrad, is there anything you wish you had done differently, or something you wish you had known at the time that you know now, or perhaps opportunities you wish you had taken advantage of to help better prepare you for the path that you're on? So two-parter there. Erica, do you want to go first?
Great.
Yeah.
So like I mentioned earlier, I did my co-op at Abbott, and I met somebody there who really took the time to build me, I would say a lot of engineers, there's that stereotype that engineers can't write. Well, I'm one of those engineers. So he really took the time to make sure that I go through documents, make sure we had good GDP, good documentation practices with how we read our protocols during my system engineering times. And, just knowing that the environment overall was very helpful and very willing to bring you up instead of pushing you down or throwing you off for not knowing exactly what you're doing, that helped me a lot. And overall, the co-op overall was a highlight of my college experience. And I can't stress how amazing it is that the School of Engineering and Computer Science made this a part of our curriculum. And it gives our students an edge to get the experience and make connections that help us after we graduate. So because like me, I was able to get a job after that because people at that company knew how I was. And I believe I applied for a level 2. I got moved down to level 1, but overall I beat other people who could have potentially had a better background than I did because they knew who I was. So that helped me tremendously. In terms of my time at the campus, I had a front desk job in CTC, the main building for the School of Engineering, where I connected with people like Dr. Martin and Dr. Cami, who, Dr. Cami was the main person that got us connections with the co-ops and everything, and she gave me a lot of good advice about what I should be looking for and how I should handle interviews and just keeping in check of how what career path I could take, or if I should pursue medical or any other different engineering route. On top of that, I also had Marche and this other lady, her name is Ian from the alumni house. I actually worked another job there too. And when I was looking for co-ops, I know they saw me stress all the time, like, oh gosh, like, I don't know if I can do this. And they kept saying, Erica, you got this. Ended up getting 4 different offers. And they're like, see, why are you panicking about this? So just having those hype people, overall made me feel like I can do this and just not focus on the background noise and focus on like the main goal of what I want to do. So for me, those type of interactions and people overall is what prepared me for my career right now. And then in terms of if I could do something differently, I wish I got more involved in a lot of the engineering organizations like Data Ta and SWE. I was always asked I can do it, but I think I focused a lot more on my studies, especially after what happened my first year. I just wanted to make sure I keep my mind, like, okay, get all your engineering stuff situated and figure out what your next step will be. I also wish I knew that our school had a minor in technological innovation and entrepreneurship. It's a minor in engineering, It's very hidden. There's like actually a whole building, the back of the campus that no one knows about, but that focuses on this. And I was really pretty much someone who wanted to do new product development and R&D work. So if I would have had the chance to know that, like at least my sophomore year, I probably would have pursued that minor.
Great, thank you. So now everyone on the call has to go find that building. That's your action item afterwards. Yeah, no, that's a really interesting industry that you're talking about. I know tech transfer and tech innovation is an emerging industry in healthcare as well. So appreciate you calling that out. All right, Serena, you want to go for it?
Yes, absolutely. So my time at Pacific. So I actually had to beg my parents to let me go to Pacific. We have this tradition. I have the privilege for them to, they will pay our way for college. We'll take out a little bit of loans, but I had to convince them, like, please, please, I really want to go to Pacific. And I made a promise to them. I said, I promise that I will make Pacific, I will take every opportunity. I will make this worth our while. And so I finally got a yes from them. And so I got involved. I was a part of Delta Sigma Pi, or DSP. I did, and I took on leadership opportunities within our organization. I was also a part of the Associated Students of University of Pacific, or ASUOP. I started as our multicultural senator, vice president, then president for our school year. I also did Tiger Team. So if you, I know it's COVID-19, but prior to that, at all of the sporting events, I was the crazy person out there throwing stuff to the crowd, getting people riled up. I was also part of the Multicultural Center and learning about equity and diversity. And that was actually where I got my foundation and my passion and love for equity and inclusion work. I was a resident assistant. And then I also had an internship outside of Kaiser Permanente, but I then did an internship for 2 summers with the county in the purchasing and finance department, which was kind of, felt like to me out of my wheelhouse, but I actually was able to get that internship through the career services department. And so all of that to say, I took on these opportunities as a way to, one, fulfill my promise to my parents, but I quickly realized that there was transferable skills that I was able to gain from being a part of these organizations. And so I was learning things in the classroom around business, around management, but then I got to practice what I was learning in my organizations. So in Delta Sigma Pi, I learned about business, around project management, how to do event planning and things like that. ASUOP around governance and compliance and how to work with teams and how to manage and supervise people. Tiger Team's all about customer service, because we would have upset people all the time because they didn't get a prize or something, and you're working with folks in the sporting events. And of course, multicultural, learning about equity, inclusion, and diversity work, resident assistant, conflict management, problem solving. And so I got a lot of these transferable skills through these opportunities and organizations. And then now when I started applying for my master's degree, when I started working, I had a lot of those tools and resources already that I've used in those organizations. And it was okay to kind of fail or make mistakes because I was learning from them in that role, and then I didn't have to make those same mistakes. And I had those learnings I could take with me into my career. So I was very, very thankful for me. So kind of, I don't think I have anything that I would want to do different. Oh, I do. Hearing Stefan, I wish I would have done international, a stint in internationally, or to do some learning in that sense, because again, I do love the equity inclusion work and I would love to learn more about culture. So I would say, but I want to add here a learning for me and something that I take with me. And the transferable skills kind of happened by osmosis, because it was just a promise I made. And then I kind of found out later, like, oh my gosh, I am really applying what I'm learning in my classroom. And I have the opportunity to do so because Pacific allows you to have so many different opportunities and get involved. But to make that intentional, that was a learning for me, is find things that I love to do, find things that I'm passionate about, find organizations that are fun, but also within that, also within that, find these transferable skills, use these transferable skills, gain resources, gain knowledge and experience in your internships, in your organizations, and you'll be able to take that with you for the rest of your career. So a lot of the things, conflict management with my staff, using things that I learned as a resident assistant. So if that is a learning that I take with me and that I would love to pass on to you all as you go through your experience, or if you're an alumni and you have these experiences, think about what are transferable skills you can take with you that you will always have in your career.
Fantastic. Uh-oh, I'm echoing there with somebody. Yeah, I was going to call out how relevant those skills you develop as an undergrad are to your professional career. You know, I was a resident advisor myself. I oversaw one of the residence halls when I was at University of the Pacific, and knowing that those skills you're developing now are important. And so finding those leadership opportunities and those budget management skills and those opportunities for public speaking, that all is going to pay off for you when you're out on the job market and competing against other people and talking about those things that make you stand out and unique as an applicant. So certainly the academics are important, we're hearing from this group, but this understanding that your leadership is equally important. All right, so I wanted to make sure that we had a little bit of time to also recognize, you know, that we're living during COVID-19, and that certainly has an impact on the job search, prospects. And Stephen, we actually have you can provide a testimonial of your experience in that arena as somebody who was actively looking for a job during COVID-19. And so we were hoping you could talk a little bit about your experience in navigating that. And in particular, you know, speaking to those students that are getting ready to embark on their own job search and maybe offering some insight and recommendations to them.
Yeah, definitely. So I joined Chemocentrics March of last year, so it's just been a year now. And my job search began at the beginning of 2020. So that was the point where the COVID pandemic was just beginning. And the job hunting process started normally, but then every day there were headlines on the news about COVID-19, and then the restrictions started to come into effect. So everything quickly transitioned to all virtual meetings. I was on the phone a lot with recruiters and hiring managers, and for interviews, they were all done virtually. So I got really familiar with all the different video conference platforms like Zoom, WebEx, because every company used a different one. And I would do everything that I would normally do in preparation for an in-person meeting. But with virtual meetings, there are also a few other things to consider. In addition to being prepared for the meeting and being presentable, you definitely want to be also in a well-lit and quiet environment. It seems like, you know, it's common sense, but sometimes you might want to tell other people that you're sharing that space with, like family or roommates, that you have an important call that's coming up. Also very important, make sure you test your equipment, your sound, your audio, your video, and make sure you're familiar with it. And you don't want to be fiddling it with anything at last minute. So make sure you, you know, schedule some time in advance before your actual scheduled call, so that you can get your microphone working, you can hear the audio from your computer, or if you're using any other listening device, and that your camera is also working as well.
Yeah, absolutely. All these considerations that you don't necessarily think about or that you're not taught in your career preparation classes, those little things make a huge difference. I know I was interviewing somebody just the other day for a senior level leadership role, and right when they were getting to this like great, you know, climactic end to their story, their motion sensor lights went out and it was pitch black. And I was like, should have talked to Stephen about some of those tips to make sure you were prepared for that part of the process. So certainly those little things make a big difference. And, you know, I think as well, the impact of your story is that you were able to navigate that successfully and land a fantastic opportunity. So for those of you that are concerned about that or anxious about how challenging that's going to be, you know, we have a testimony here of somebody who was able to successfully do that, and understanding that this is going to be the new normal for a while as well. So really getting familiar with that technology. All right, so I have one more question for this group before we open it up for Q&A from everyone else. So those of you that have something percolating, you'll have your opportunity in just a minute or just a few minutes to ask that question. So the piece I wanted to end with is really talking about the strategies that you all take advantage of to build community in the workplace. You know, for those individuals that are graduating, leaving college, you know, in many ways you're leaving a safety net. You know, you're leaving your network, you're leaving your people, and you're stepping into a new space. And you know, not only are you moving into an environment, but we're doing it during this virtual time. And so I'm curious to hear from each of you about how you've built community in the workplace, how you find those peers to connect with, and in particular, how you're navigating that now, given all these unique challenges that we're facing. How about we start with Erica for this one?
Okay, so one of the ways I'm finding community is my team actually does these weekly Friday check-ins. They're like little wellness, I wouldn't say wellness, but they're like overall check-ins to talk about updates of the week from our main manager, but also see how everybody's doing with work and overall how we are all doing well-being. So it's been quite nice. We actually have all our cameras on. It's not like a happy hour or anything, but you know, it's this nice sense that you're still staying very connected with your team and have the sense that it's okay for us to reach out to each other on a weekly basis, especially since, you know, like we may not go in the office, which actually currently right now I still do. But you know, when we don't, like, it's nice to have the visual of seeing everybody. On top of that, I'm also part of a core team. I'm a core team member of this organization at our company called WLA. It is Women Leaders of Abbott. So I stay engaged with the book clubs that we have, but we also have monthly events. I'm actually currently working on a wellness workshop series so that our site can get these tips on taking steps towards self-care. So just being more involved with these items and just like seeing what our company offers on a monthly basis. I try to take those opportunities and see what they can do. I think a lot of people have this fear of reaching out, especially to like higher ups, to just kind of get perspective. And we actually had a talk from this one speaker. She was the vice president of quality. A lovely lady. I actually messaged her after her talk just to say, you know, I related to you very much. I would love to speak with you one-on-one. And I got a one-on-one with her, you know. I always take the opportunity to email them, let them know that you appreciate their time. And then just, like I said earlier, a lot of my interactions, a lot of my way of getting to where I am today was being able to speak to people. So one, I would say try to look into finding a mentor if you can. If not, you know, it's just good to talk, to have the opportunity to see what other career paths there are. So overall, me finding community is just taking that step, even if other people can't. Just go in there, be in their face if you can.
Yeah, I like that. And, you know, finding virtual ways to do that as well. You know, as you were talking, I was actually thinking about LinkedIn in particular, and that being a really powerful tool to connect out and find other people that are in similar situations as you or work in the same field as you, and just making the ask, you know, understanding that people are certainly amenable to being contacted and being a mentor and sharing as well. So appreciate you sharing that. All right, Stephen, how about we have you go next?
So for me, I started at Chemocentrics, and it was all virtual. So even my onboarding was all virtual. So every opportunity that I had to connect with someone, that was, you know, my first time doing it virtually. But I would take every opportunity to try to be a little bit vulnerable and, you know, share a little bit about myself with them, and also, you know, take that opportunity to ask them questions and make it into a chance where you can, you know, have them give you a little bit of guidance or mentoring. So I think being able to have those conversations where you can kind of talk about things like, for myself, I recently moved to a new apartment. So just being able to share that with my manager and say, hey, I'm moving. I know there's a lot going on right now, but this is happening in my life, and just wanted to let you be aware of that. Or other times it's, you know, we would have a conversation about a work item, and then at the end of the meeting, you could kind of ask a little bit more of a personal question to kind of connect with that other individual that you're talking to. So these are all ways that you can take the opportunity to connect with other people. Even though it's virtual, I would say it's not that different from being in person. You're still, trying to, connect with that other person and, find those points of common ground with them so that you can really develop your relationship with your future colleagues and managers.
Great, thank you. Appreciate you sharing that. And certainly this idea of, relating on the reality of COVID-19 and the unique circumstances that we're all facing and being transparent about that. We're all going through this together. And so certainly during these times, it's easy to feel lonely and it's easy to feel a bit more isolated. And I think relating on that level and communicating to your managers and to your leadership some of the things you're going through is certainly a powerful message for everybody. All right, and then we'll have Serena bring us home.
Yes. So I would say to build community, I really looked within Kaiser Permanente. So we have the privilege truly to have an organization who invests in equity, inclusion, and diversity. And so we actually have affinity groups built into our internal workplace. And so I alluded to Kaiser Permanente African American Professional Association, or CAPA, but that's really where I found my community. I started off as a member. It was kind of a word of mouth thing where I was talking to a person who happened to be a member, and I'm like, I would really like to get involved outside of my current role. And we started talking about health disparities within care delivery. And she said, hey, you should really think about joining this group. And so I started off as a member and quickly realized, and this is all volunteer, so it's not a part of our role. So that's why I call it our labor of love, because it's a labor, but we love it. And so able to get connected in that way. And that's where I found my community. I found people who had similar passions in health disparities, health inequities, and social determinants of health, and wanted to volunteer their time and resources in partnering with external organizations to move certain initiatives and programming forward. So I was able to find my community that way, by word of mouth, by talking to folks about what I'm interested in. We weren't talking about our role. A lot of the times, healthcare is so dynamic and fast-paced. You're oftentimes talking about the next project or the next thing you have to do, or you're talking with your staff. But I'm very grateful that where I work, it's also very humanistic. So we have tons of opportunities to talk about other things that interest us, other things in our lives. So I was able to find community in that way and actually build in leadership opportunities. So I started as a member, then I became an events coordinator, then I became the president for our Southern California region, and now I'm national across 8 different regions. And so that has been a really cool opportunity based off of just having a conversation with somebody. Outside of just the everyday job role. And then also so in our oncology department and all my departments outside of our RN Advice Center, we have our medical providers, our doctors. And so again, I happened to bump into one of our doctors, and I was before COVID-19, and I had my gym clothes on. I'm like, oh, I'm going to yoga. And she's like, oh my gosh, we love hot yoga. So we started talking about Bikram yoga. COVID-19 happened, fast forward months later, almost a year later. And she's like, hey, there's a mom's group. I'm not a mom, but there's a mom's group. I would love for you to come. We social distance, do yoga in the park. Would you like to come? And built community that way. So I know a lot of the time when we sit down and we go to work, we think about work and we want to talk about work. And I think it's also, especially in healthcare, we are so humanistic. We're truly caring for people. I think all 3 of us can talk to our mission is serving and helping and supporting others during some of the most happiest time of their lives, during some of the most vulnerable times in their lives. And so to also bring that into that kind of aspect into your work so you can find community and build community. And I encourage you all, as you get your opportunities and you land these amazing jobs, or if you're already in an amazing job, is to also stop and think about your own self-care, especially through COVID-19. Talk about what you're passionate about, what your hobbies are, and then find your community that way by folks who are going to be like-minded and can connect you if you're not already connected, or do your research too on how you can get connected and build your own community.
Fantastic, thank you. I know I was going to try to close with something profound, but I think you said it for us. I really appreciate that closing message, this idea of, understanding that we are all people, and we are living in weird times. Circumstances are unlike anything we've ever gone through before. And this idea of keeping those connections alive, that vulnerability, that transparency, that humanistic approach is so important now in the workplace and in our personal lives, and understanding that for many people is that connection back to healthcare and that drive to want to do that work. So this ends the formal part of our presentation. So I wanted to first give our panelists a round of applause. If you want to use your reactions there, that's what I do to give my little round of applause to everybody. And we have just a few minutes for anybody who wants to ask any questions. I think the instructions are to drop them right there in the chat line. If you have any, we can stick around for a few minutes to do that. So now's your opportunity. You have 3 brilliant minds on the screen here, so feel free to throw those questions out. Or if you're feeling extra bold, you can unmute and share at this point as well, I think.
I'm feeling bold, but I don't have a particular question at this time. Hi, I'm Naomi. I'm a grad student in health, exercise, sports science, undergrad focus in computer science. So the joys of like data analytics within the health field. So it was interesting to hear the different ways it has come together in your fields. So if anything, I'd like to say thank you and hello to some familiar faces.
Fantastic. Yeah, thank you for joining us. You make a good point. One of the pieces we didn't get to talk much about were some of these emerging areas in healthcare, and I think data analytics is a huge one. So I appreciate you calling that out. And then Serena talked a lot about diversity, equity, and inclusion, understanding that is essential to what it takes to be successful in this profession moving forward, is understanding that different communities need different types of support and equitable support, and knowing that that's going to be embedded in any healthcare position in the future. All right, I see a question in the chat line. Oh, go ahead.
Sorry, I just wanted to add for Noemi, is also I deal with a lot of data and trending and analytics. And so it is very important to have folks who are experts in that and know what the picture, like to be able to, one, gather the data, clean the data, and then be able to provide a picture that everyone can understand who are not in that realm is ace in the hole. And so I'm so happy to hear that that's your expertise, because that is definitely needed in the healthcare industry. So I just wanted to call that out.
Fantastic, thank you. And there's a question in the chat line from Marche as well. So we'll send this one over to Erica. Can you talk a little bit about how you stay current on industry trends, and maintain that cutting edge knowledge about your industry and the work that you do?
Well, I mean, so currently I've been in my position for 1.5 years, so I feel like everything I'm learning every day is new. I feel my manager and I have talked a lot about things to help me continue with my career development. He actually suggested that I look into LinkedIn Learning. It's a section in LinkedIn that you could look into just specifically for like whether it's tech or just basic things like project management. A lot of the things I'm currently working on right now is project management skills and presentations so on top of my industry work, but a lot of the stuff that I'm learning in terms of my industry is solely based on documents that's within our Abbott system. So I can't really put too much comments on that. But I would say if anybody wants to have, these vital skills, these skills in terms of holding meetings, being able to manage a project once you actually go into the field, I would highly suggest going into LinkedIn Learning. And trying to think if there's anything else that I currently do. No, not that I can think of at the top of my head.
Great. Well, I think, what really stuck out to me was this message around lifelong learning and this understanding that what you're learning in college now, both in the classroom and through your leadership opportunities, is relevant, but your learning doesn't end when you get that first job. Every day for the last 1.5 years, it sounds like you've learned a new thing, and understanding that is part of your career path, as well as this eagerness to continue to grow and evolve and be the best possible performer in the work that you're doing. All right, so I see another question in the chat there. Maybe Stephen, you can tackle this one. So the question in there is from Andy Lee. What is the biggest decision you made that you think was the largest contributor towards what you're doing today? So that's a big question, you know, very existential. You know, maybe thinking about a pivotal moment in your life, a decision that you made, maybe about your academic pursuits or your leadership opportunities that really helped set you on the course that you're on now. Oh, I think you might be on mute there.
So I think that's a great question. And I think a lot of people, you know, sometimes question themselves about, okay, what was that moment or what was that time? And if you really want to break it down, I think every step, every action that you make will eventually lead you to the right place. I know it might sound cheesy, but that I would say, you know, just give yourself the confidence in knowing that, you know, everything that you're doing is the right thing for yourself. But if I were to have to choose one pivotal moment or one thing that happened was, you know, every time I chose to make a career change, so those big leaps of faith when I switched from audit to consulting, or my latest one when I decided, okay, I'm going to come out of consulting and start looking for jobs in industry and, you know, go into healthcare. And that was a time when I really had to reflect and think about, what do I really want and what would make me happy? And, you know, what are all of the things that are important to me in my life, and do they align with my values and goals? And when I was job hunting, I was coming across a lot of different things, and it made me think a lot. And I'm just really glad how things ended up and where I am now today.
Fantastic, thank you. And then I see there's a couple questions in here just about opportunities and career paths. And I don't know that we'll be able to get to all of them, but if nothing else, what we want to articulate is that healthcare is an ever-growing industry, and the need for healthcare professionals, both the folks that are doing the work with patients, the nurses, the physicians, but also this massive infrastructure that exists behind the scenes to make everything operate, from HR positions like we heard about today, to folks that are doing research and finding products and doing innovative technology work, to the support staff, the folks that are checking patients in, the folks that are supporting physicians and so on. There's just so much to the healthcare field that folks can explore. And I think that one of the takeaway messages from this, you know, as role modeled by our panelists today, is the importance of exploring, you know, talking to people and networking and reaching out on LinkedIn, talking to your career advisors. We have fantastic resource on the call, and starting to ask these questions, you know. And as a recruiter, something I recommend as well is, you know, if you know you want to work at Kaiser one day, or better yet, you want to work at UC Davis one day, just kidding, University of the Pacific, anywhere else, you know, perusing their career sites and just seeing what types of jobs are out there where your skills and interests align will open up a world of possibilities. And knowing that you're also not going to have it all figured out today. You know, that's why we're talking about career paths and career journeys, and understanding that, you know, new opportunities will present themselves over the course of your professional career, and being eager and open to exploring those topics. So what we wanted to do to close was actually have folks, if you want to drop in what you're interested in learning more about. I know the rest of us are going to stay on the call for a little bit, and so there might be some opportunities for some follow-up, for some networking, and also identifying, you know, each of us as a resource as well. So you can connect with us, you can reach out, and I'm sure everyone on the call is willing to build that relationship with you as well. So with that, I know we're a little bit over time, so I wanted to thank everybody for participating today. To our panelists, we appreciate your time and your transparency and your willingness to share your story with us. And for those of you that tuned in, hoping that you had some key takeaways, and knowing that attending sessions like this is a great step towards pursuing your own career. So with that, we want to wish you all a great night.